scintigraphy of the same patients, and all these black dots in vertebra, in skull, yeah, in ribs, yeah, and especially in pelvis and even in femur, these are metastases. And we can see them there, and no metastasis there. The same here, yeah, nothing interesting in this femur, and see, this is tumor, yeah, this is tumor, this is metastasis, yeah, and so this is how it works, yeah. Well, some people say, okay, this is just simple X-ray, it's so old, so simple procedure. Well, let's compare CT, okay, let's compare CT. This is a CT picture of the patients with cancer, and okay, we see metastases, but we see two of them, yeah, only in these two neighboring vertebra. But look at this bone scintigraphy thing, all these black dots, these are metastases, and they are everywhere in the vertebral column, and that means that need to treat this patient in some other manner, because this is advanced tumor. We can probably treat these tumors locally, but we cannot treat all the vertebral column locally. So this makes difference. So this is why it's so important, yeah? And another example, see these two pictures, yeah, this X-ray and this scintigraphy picture, they are from a patient with pulmonary embolism. And can you see any signs of pulmonary embolism on this X-ray? No, they're just clear. They are black as they're supposed to be. And if you look at these pictures, these are perfusion images of lung, yeah? And see, the black stuff, this is normal lung tissue, and these white spaces, and this triangle white space there, these are perfusion defects, yeah? So these are areas of pulmonary embolism. Yeah, we'll see them definitely, like in some days later, because there will be infarct pneumonia, and we'll see it for sure. But these lungs. How come we can say, actually the idea is good, because sometimes metastasis can be calcified. And if it's we're talking about calcified metastasis, it's possible. Sometimes they catch one like this. But in this situation, these are lungs of the patient with end-stage renal disease. And what they're doing, they're trying to be kidneys in some roads, yeah. They're trying to get stuff out of the body because kidneys don't work, yeah. And so, because this is cancer, yeah, we see lungs in this situation. And again, in this patient, we see some uptake, yeah, in soft tissues. What does it mean? That means that there is something calcified there. So, and this is after big trauma, we see sometimes something like calcifying myocarditis, yeah. So this is like this, an inflammation which is calcifying, yeah. So sometimes it works like this, and this is specific for radionuclide disease, yeah, or for radionuclide technique. And what is very special and very interesting and very useful, this is the thing that we can use one radiopharmaceutical administration and have a whole impression, yeah, of the disease in the whole body. Well, we discussed it already a little bit there, but if you look at this picture, actually these are the pictures that this fancy radiopharmaceutical, which is the most widespread, is FDG, yeah, and this is how it's used for tumor staging, yeah. These are 4 different patients with 4 different stages of cancer. And looking at the amount of tumor burden in the body, you can definitely say that this is stage number 1, 2, 3, and 4. Yeah. Well, there are special criteria which we should follow, but even don't know if you don't know this criteria, it's possible to understand. Yeah, this burden of disease is bigger and bigger, and that means, yeah, that we can differ what is the stage. Yeah, and so this is very interesting and very useful. Yeah, and one drug administration and all the information in our hand. Yeah? So this is good about R&D information. But what is bad? If you see these pictures and you don't know that they're kind of fancy in content, their quality. What do you think about their quality?
Not so good. Not so good.
It's not good. It's something blurring, yeah, something when you have, okay, I have to make guesses, what is this, where do I look at, yeah? And this is kind of really tricky sometimes, yeah? It's a little bit better in PET. So if you compare these pictures, yeah, these are SPECT pictures or scintigraphy pictures, and these are PET pictures. And right now it looks like this, yeah. We are not thinking like, okay, this radiodiagnostics, yeah, this radionuclide diagnostic, it's not useful because the quality of the pictures is awful. Yeah, we just try to figure out that we have different options to look at the body, and some of them, actually almost all of them, They are kind of anatomy pictures. They are detailed like CT. I don't know if other people in India or not, but it's in English, actually American offer, but I don't know. Do you know that Richard Scarry? It's offer many of children's book. And they're devoted to like a very funny cat, Huckle by name, and it's his friend Lovely Worm. This is Lovely Worm. And they live in a very special fairy city, and there are many adventures, and usually this guy is lost, and this Huckle cat have to find it somehow. So this is more not my creation, I just found it in the internet, but I like this metaphor. So this is how to look for this guy in a big city, yeah? So city, it's like big city, it's like surroundings, it's like background, so, and it can give us a good picture of these surroundings, of this background, because it's anatomy, yeah? So buildings, streets, cars, yeah? And so Lovely One, it's a personage, yeah, it's something, yeah, it's target, yeah, and if we use something like radiopharmaceutical, yeah, like with tropism, yeah, we can find it easily. Here is Lovely One, here it is, but where it is, yeah, if it's just R&D, no idea, because the surroundings, the background is like in digital subtraction and geography, something very special, yeah, we cannot figure out. But how do you like this idea? To combine this, yeah, to do it like the city from city and the personage Lovely Worm from this fancy pet picture, and it looks reasonable. We can find it easily, yeah. And so this is how it basically gone today, yeah. So think about that, yeah. If we combine anatomy image, functional image, and
Then we
combine them, we can have something like this. And on this picture, yeah, we can see both structure and function. Yeah, so this is how it usually works. Right now, we usually do it like this, yeah. So, yeah, we use the black and white scheme for anatomy, for background, yeah, like this, yeah, and these function images, SPECT or PET, yeah, for function information. Usually, we use it in color just to differ them, yeah. And we combine them. If you don't like this children's book, you can use more sophisticated, like like comparing two pictures, or a little bit later we create some software which help us to combine them using this software. But right now we prefer to create machines which are a combination or fusion of these two techniques, yeah. And these can be techniques, yeah, which are combination of SPECT density and PET density, and even sometimes, I'm not showing it to you right now, but show it to you later, they can be combination with MRI, but it's much more expensive and much more difficult, but it's still possible to do, yeah. Usually, yeah, and basically it's real combination like this, yeah. You see, remember this picture of this machine, and we say that this is SPECT machine, but actually it's not only SPECT machine. What do you see behind this SPECT ears? What is this? This is CT. It's gantry. And so we can put the patient on this table, yeah, and move it, don't taking it out of the table, from one gantry to another gantry, yeah, and collect the information in a very precise manner and quickly, and so this is really good, yeah. And we can do it in the same manner in the PET CT. It's like two gantries in a row. One is for R&D and one is for CT. And in PET, we can do even more sophisticated combinations, and from outside, it looks like just CT machine, and it's kind of one, but the combination is in layers inside, yeah. So this is the X-ray tube, yeah, and its detectors, and these are these positron emission tomography detectors, and they are all combined, yeah, they are close to each other, yeah. And that is how we can get this picture even quickly, in more precise detail, and even using less radiation exposure, because they have two electromagnetic ways, which we can use one instead of other for our calculations. And so it's kind of a really good idea. And that means that we can have anatomy, yeah, physiological and fused image from one machine, and this is really cool. And basically all new machines which can perform these R&D procedures, they are like this, yeah. And they also can be fused images in planes, yeah. And since they are all computerized tomography, we can create 3Ds, we can create 3D reconstructions, and they can be CT reconstructions and they can be fused reconstructions, and all from the same machine, yeah. And so this is really, really good, especially in cancer patients, yeah, in tumor patients, yeah, and really, really good. So if you go and speak about PET, again I put it in brackets, that it will be definitely PET-CT some years later. I'm sure that it will be like this. So many things are similar. So again, we can have slices, yeah, and we can have 3Ds. But again, remember, yeah, that in PET, the first is axial slice, because the technique is like this, yeah. And so they see the axial slices, PET ones, yeah, CT ones in different windows. Pay attention, yeah. And these are the combination of fused images. Actually, in Russian, the more used is combined images, but in English, it's more used like fused images. Yeah. And again, they see 3D reconstructions, and they again, yeah, they have CT part, yeah, and they can have this R&D part. And what do they see else? Yeah, we see something like this, and at first we can think, okay, this is this planar image, yeah? It's real close to this thing, yeah? But this is it, and it doesn't have this ability to produce summation image. So what do you see there? A special 3D reconstruction. So it's one picture, not two pictures like there, yeah, to see both upper and bottom part, yeah, yeah, and it's, yeah, this is 3D reconstruction. It's a very special, it's a pretty simple 3D reconstruction. It's named maximum intensity projection, or usually you will see it's an abbreviation like MIP, and that means that the machine mostly represent in this picture are the voxels with very high levels of uptake of the radiopharmaceutical. And it's like an advanced summation image, kind of advanced summation image. So we can see the whole picture, yeah, the distribution of the tracer, but the technique is not summation, but 3D reconstruction according to very, very simple rules. So this is how it works. And the last thing we'll do today, let's learn how to recognize that this is an FDG PET study, because it's the most popular study, and it will definitely have 2 or 3 pictures of that in your image assignment. So, can you guess how can they say that this is a FDG, a glucose PET? What is the tissue in our body which is like really greedy for sugar?
Liver.
Oh, liver also, but there is one tissue which is really more greedy for sugar.
Sugar.
Brain,
yes, brain.
So if you see brain like this, you see this black dot. Okay, let me hunt this pointer. Okay, can I do it? Where is it? Okay, I'll show it like this, yeah? So this is brain, this is brain, this is cerebellum, and this, and this
Red part is brain.
Red part is also brain. So if you see something like this, brain, yeah, uptaking glucose in study degree, you can be sure 100% this is FDG PET. There are no studies like that in modern radionuclide technique. No studies like that. So you can easily recognize. You're sure, yeah? It's again, it's good and it's correct about liver and about heart, because they are tissues which need sugar. But the brain needs more sugar, and so it's every time it's a real brain. One question for you: how do you think, is it a good idea to look for metastasis in brain using PET FDG?
No.
Why?
Because there is no vessels, like